Welcome back, everyone. Dr. Jeffrey Lobel is with us today from Lima Memorial. He's a neurosurgeon out there. You're going to tell us all. I had to write it down so I remember. Fluorescence guided tumor resection. First of all, if you could tell us what that is, that new technology.
Yeah, it's a technology that's been around actually for a few years. And what it is, it's a chemical that we give to patients that helps enhance where the tumor's located so I can actually see it better when I'm operating. I actually use a microscope with a special light that makes it glow. So it's kind of like Star Wars technology if you think about it, but it has very little side effect, and it actually helps me tremendously when I do brain tumor surgery.
Before that came around, that technology, kind of if you could compare it to what you had to use before and that technology and how things have improved.
Well, to compare the way we do things now, we just generally depend on our eyesight to see subtle differences between a normal brain tumor and an abnormal tumor. And this is really a tool that enhances my ability to make the differentiation between what's good brain and bad brain, because it's sort of like operating in a piece of butter and everything sort of looks the same. But when I give somebody this chemical and turn on the light and illuminate, let's say, that piece of butter, one part of it, which is the bad piece, will glow red, for instance, and the rest doesn't glow at all.
You hear so many cases around the world, as you just mentioned, where somebody goes in for brain surgery to get that tumor removed, and then maybe doctors have to go back in later because there was part they missed or they had to go back in and check things out. I would think that what you just described here, the way that the method that you were using would kind of prevent that or maybe draw back on that a little bit.
Well, like I said, it's a tool that helps increase what I can operate on safely. There are parts of tumors that unfortunately we don't necessarily miss, because if we remove those parts, they may take memories away, such as your first date, or affect how you speak. But what's nice about this is if there are sections that I can safely remove, I can see them better. So the brain is very difficult to operate in. And again, when you've got so many resources available to you, you just end up with better surgery.
This type of resection then is the preparation for it for the patient themselves. Is it different from old methods? Or maybe walk us through that process.
Well, what's nice about it is the preparation is pretty simple. Currently, we'll admit somebody to the hospital the day before surgery, make sure they have all their tests done, make sure they have all the imaging done that I need. And then about 4 to 6 hours before we do the procedure, they drink the chemical, which is an amino acid essentially, and it goes and circulates through their body and sort of finds its way into the tumor. There are minimal side effects other than people are sensitive to light for about 24 to 48 hours, and that goes away. And the sensitivity is usually in the form of a sunburn if they expose themselves to too much sun.
Yeah, it's fascinating to hear about it, and the fact that it's being done right here in Lima, Ohio. Dr. Lobel, thank you for telling us about it. We appreciate it.
Thanks for your time. I appreciate it too.
You bet. Nice chatting with you. We'll be back after this.